Testing. Hopefully this mic works. Hello? Hello? Hopefully this works. Hi, my beauties. My name is Dr. Stefani Kappel, and I'm a board-certified, fellowship-trained cosmetic dermatologist in Newport Beach, California. And today, I'm so excited, or tonight, I'm so excited to be doing a video on Ellacor. This video is just dedicated to Ellacor, which is microcoring technology. So you guys are probably going to be seeing this a lot all over the internet, all over social media, all over everything, because it is a revolutionary mechanism of action. So what exactly is microcoring? It is the first of its kind. It's a brand new revolutionary mechanism of action for skin tightening. And basically what it does is it removes columns or microcores of the skin to tighten the skin. So it's unlike microneedling and it's unlike lasers, and it's a new technology where you're basically excising skin in a very controlled, scarless fashion to remove skin for essentially a scarless facelift. So I hate to use terms like, a non-surgical facelift, but this is the closest thing that I think we've ever had to it. And I'm going to get into the technology and the evolutionary of the device. And I'm actually very proud and excited to say I participated in the clinical trials for this device back when I was a fellow with Dr. Suzanne Kilmer, who's a world-renowned laser and device expert, and I was in my fellowship, and this was just back in 2017. And it was amazing then, and I've been waiting and waiting and waiting for this device to become FDA cleared, and it's finally available, and they've even improved it even more. So I think it's a great tool to have in our toolbox as cosmetic dermatologists, and for plastic surgeons to have a non-surgical option for skin tightening and for rejuvenating the lower face especially. So like the perioral lines, perioral rhytids, laxity, extra skin in this area, it is FDA cleared for skin tightening of the lower face. So before I move on, I ask that you like and subscribe and hit the notification bell, because I drop new dermatologic information every Sunday. And as a fellowship-trained cosmetic dermatologist and laser surgeon, I just love bringing new technology to you guys and things that actually work, that have stood the test of time, that has really shown improvement in clinical trials and is getting a lot of positive feedback from well-respected experts in the field of dermatology and cosmetic dermatology. And I love bringing this information straight to you. So this is not sponsored. I have no ties with the company. I did participate in the clinical trials, but I am never sponsored, and I never accept payment from any companies to promote their products, even if it's a device I like, because I love the authenticity and the autonomy to just recommend what I feel is best for my patients and not saying things because somebody's paying me to. So I have some notes that I'm going to refer to, and I just recently attended an academic meeting where some of the world's most renowned laser specialists and cosmetic dermatologists had a meeting of the minds, if you will. It's called Masters of Aesthetics. It took place in San Diego just last weekend, 2022. So in case you're watching this video years later, it was all the buzz at this meeting. And this is just world-renowned experts. So Dr. Matt Avram from Mass General, Harvard Medical School, Dr. Omar Ibrahimi in Connecticut Skin Institute, just people from all over the world, and especially in the US, who are leaders in dermatology, just saying amazing things about this device. So when they speak, I listen, and most dermatologists and cosmetic aesthetic fellowship trained dermatologists who attend these meetings with like the creme de la creme of the experts, they were giving lectures on this and just showing before and afters and just talking about the patient satisfaction rates, and as providers, their satisfaction with the before and afters, and the amazing results that they are achieving with Ellacor and the microcoring new technology. So what is this device and how does it work? So basically this device contains these hollow needles that excise pieces of skin out. It's basically these little cylinders of skin that get excised out. They're super tiny and they're scarless because they're taking such a small amount of skin out. There's no scar that's left behind. But when you take thousands of them out, you're basically removing excess skin, the same amount of skin that would be removed if you were having a facelift, minus that horrific facelift scar that people have that goes around like the front of the ear and into the scalp. You're basically excising the same amount of tissue, but you're doing it in little microcores. So you're excising the same amount of tissue in a scarless manner. But it's not a facelift, obviously, and I really want to be clear and always very transparent. when you have a facelift, there's different types of facelifts. Now, I'm not a plastic surgeon. I'm a dermatologic surgeon and a cosmetic dermatologist. But as a Mohs micrographic surgeon, I can say skin is our domain, and that's where dermatologists usually end with our surgical prowess. So as plastic surgeon, usually in a facelift, we'll move the smaz, the fat, the muscle. There's a lot more than just the skin that goes on in a facelift, or that could go on during a facelift. But microcoring in many of these devices just remove the skin. But the same amount of skin is removed with the microcoring procedure that would have been removed for a facelift. So you can imagine taking all that, and patients always come into my office, they're like, doctor, I want to do this. Can I do this? Can I do this? It's when you're doing that, you're taking out all that skin that would have been removed in front of the periauricular or in front of the ear area, and you're lifting it up. So you're taking all that skin. Of course, you're not moving muscle or any smaz or moving fat or anything like that, or doing fat transfer, but you're just pinching that skin, which is perfect and usually often just enough for people maybe in their 40s, 50s, 60s who aren't ready for surgery or may not be a candidate for surgery for medical reasons, or just some people who just don't want to have surgery. So it would be a perfect option for that patient population. Also, people who have those little kind of indented lines when they smile in the mid-face, perfect for that. Jowling or nasolabial folds that are more prominent or deep would do really well with this procedure. And also, one of my favorite things is the perioral rhytid. So those lines that you get around your mouth that are those etched in what we call smoker's lines, although people get them who don't smoke. Usually most of us don't smoke, and we'll get those perioral rhytids or around the mouth wrinkles or smoker's lines, which is like a terrible word. I don't know why they call it that, but the smoker's lines, because there's no amount of surgery that you can have done that's going to fix those lines. And sometimes when we do filler or when injectors that are not as, I hate to say not as highly trained, but when they're first starting out, they'll just do a ton of filler in that area. There's no amount of filler that's going to relieve those etched in lines without making you look over full or weird. And so I think that this is a great option too when we're getting into this epidemic of filler fatigue and people are just trying to stretch out the balloon by giving people a bunch of filler. Instead of doing that, Dr. Ibrahimi said it in one of his talks, instead of stretching out the balloon and filling it to make it smoother, you're basically making the wrap tighter. You're making the skin tighter by excising that excess skin, and will help with those little problematic areas. So once that skin is removed, there's no dissipation of heat, there's no thermal energy, there's no thermal damage to the skin, and the dermis can realign and close back up. So you're taking a piece of the skin out, and then your dermis is realigning, and everything's getting cinched down and tightened. And these microcores usually heal within hours to days, so the downtime actually isn't too bad. As a matter of fact, I was told by people who have been using this device that the downtime from microcoring is about 4 or 5 days to 7 days, so about a week of just gentle cleansing and using something like Aquaphor or Vaseline for the post-recovery period. It's actually a lot easier to go through that recovery than it is to go a fully ablative laser or resurfacing or microneedling. So the recovery time is more sped up, and I think that's because there's no dissipation of heat, there's no thermal damage. Tiny bits of skin are taken out, but it's so small, it's like the perfect amount because it's small, big enough to make an impact, especially when you're taking out thousands of microcores, but the skin is healthy and intact and it just closes right up. And usually the recovery time has been reported to be about 1 week on average. So to kind of get into the history of this device, because I feel like this device has, just really come out with some real powerhouses behind it. So it was developed by a dermatologist by the name of Dr. Rox Anderson, who has contributed immensely in the field of dermatology. He's like a giant and a god in the field of dermatology. I remember I never get starstruck. I did my residency at UCLA, and I'd see celebrities and A-listers and influencers all the time, and I never really was fazed by it. But when I met Dr. Rox Anderson at Harvard for my interview, I was so speechless and starstruck by his beautiful mind that I couldn't even remember my name, and I looked like the biggest idiot, and I would have probably bombed that interview, but I recovered really fast. But he's just such a brilliant mind, and he's the man and the genius behind this development of this device, and also Dr. Jay Austin, who is a plastic surgeon as well. So this came out of Harvard Medical School at Mass General Hospital, and Dr. Rox Anderson is the mind behind many of the advances that we use in clinical dermatology, cosmetic dermatology. Fraxel, he helped invent cool sculpting, V-beam, so many different lasers that we use for brown spots and red spots, and he actually did laser hair removal, the first studies, and laser tattoo removal. As a matter of fact, my clinical mentor, I hope I didn't just hit my mic, my mentor who trained me as a fellow, Dr. Suzanne Kilmer, was Dr. Rox Anderson's first fellow, and out of Harvard Mass General Hospital. And they, in the 90s, like had this, she showed me like one of her first papers, and it's like, wow, how a laser can be used to remove tattoo, or a laser can be used to remove hair. So it's basically, he's the genius that came up with the theory of selective photothermolysis. I don't want to dork out on you too much, but like the science behind all of his innovations has been amazing. He's the one with Dr. J. Austin who came up with this mechanism of action and this revolutionary technology. So I'm going to read off of some of my notes here that I took from the meeting. So Ellacor works by removing small cylinders of skin. These holes close up and do not cause any scarring, which is amazing. And unlike surgery, it helps with the texture of the skin. You can't surgery your way into having beautiful skin. You can lift and suture and cut, but to get the texture and the quality of the skin, you need lasers or devices like Ellacor or microcoring that's going to help with the integrity and the texture of the skin. Also, it's one of the few procedures that can help with those perioral lines. Even if you have a full face and neck lift, you're not going to improve these perioral rhytids or those smoker's lines. So it's really helpful for that. It's a unique mechanism of action. There's nothing like it on the market today. It's the first of its kind. And unlike microneedling, microneedling doesn't remove tissue. And microneedling often is accompanied by radiofrequency or some form of heat. And the microcoring device removes tissue, and there's no heat damage or heat dissipation in the skin. So the healing time and the recovery is a little bit better, and it's definitely different than microneedling, and it's different than lasers, and that's why. So what does it look like? What does the actual handpiece of the device look like? So it's a 10 millimeter square area, like a square, and you can choose what percentage of microcores you want to take out. So I think you can go anywhere from 5 to 10%, and that's how many cores are taken out per square area. And you can change that, which is really cool. And also you can change the depth. So I think it can go anywhere from 1 to 5 millimeters, I'm pretty sure. It may even go deeper, but I think 5 millimeters, and I'm sure that down the pipeline in the future, they're gonna have different handpieces that go either shallower or deeper for like body contouring, for like under eyes, for that delicate under eye skin that needs a more shallow depth of microcoring, and so forth. So it's really cool to be able to adjust the percentage of square area of microcores you take from the skin and the depth of it. So it is customizable. It comes in a cute little platform with like a little computer. It's just this cute little sweet sexy device. And it's funny because if you look at, I'll try to post a picture, but if you look at the clinical trials, it was this big, heavy, clunky blue metal machine. But this is what devices and lasers look like when they come straight like out of MIT or Harvard or Mass General. When the engineers come up with these, they have these huge, clunky, crazy devices, and then they perfect it, and they get the software and they make all the improvements, and then they come into these sweet little, packaged, really cute devices that you see at meetings at, different expos and in derm offices and things like that. So it's really cool to have seen it from the day that it was born. It's like my little baby device that I love so much, from the day that it was born in its infancy, and just to see it, come to fruition, and just have, to see what it's capable of doing, and how it may revolutionize, the way that we practice non-surgical, cosmetic dermatology and non-surgical options for skin tightening and skin texture improvement and things of that nature. Now, I also want to say that when microneedling, I hear myself talking about this device, and the cool thing about doing my fellowship under Dr. Suzanne Kilmer, where we did a lot of clinical trials, and I had access to a lot of these lasers and devices, many of them that have made it, many of them that have failed. For example, like plasma laser, you hear about that here and there. It wasn't talked about at our Masters of Aesthetics meeting, which shows you that it's probably not that great of a device as it exists now. But back then, plasma lasers were going through clinical trials and were all like the talk and the buzz on social media and things like that. And they never really came to fruition, and then they get repackaged and they talk about them again now. They didn't really work back then, not really impressed with the data now. But, things like microneedling first came out in, 2016, 17, Kim Kardashian posted on it and it was all the hype. And I was actually really excited when microneedling first came out. But then, we've gone in the Laser Institute where I was, we went through like a Profound and an Infinity and Vivace, and patient satisfaction rates weren't what we thought and hoped it to be. And this may happen with Ellacor. It happened with microcoring. And I'll always be very transparent and just speak with authenticity and honesty. I know, though, from before doing the clinical trials how amazing those results were. So I've seen it, and I've seen patients be happy with it, and I've seen the results. But, say that it ends up not being what we thought it is, then, I'll have to say, well, we tried it and we had high hopes and it, wasn't what we thought it was going to be. And that happens a lot in aesthetics and laser medicine with these new devices, even with new injectables and new technology. Some big thing comes out and then it either ends up becoming amazing and becomes mainstream and you feel super cool because you heard about it like years before it became mainstream, or sometimes it just has underwhelming results and it really doesn't go anywhere and you're like, oh, well, that would have been cool, but I guess we're not going to use it because, it's not as good as some of the other comparable treatments that we can do for our patients. So it's a fun and exciting field. Things come around all the time. New things are always popping up, but I really do think that Ellacor and microcoring will be a really cool, revolutionary new technology that will be another tool in our toolbox that we can use for our patients for skin tightening and improving skin texture, especially for those who aren't ready for surgery or who don't want to have surgery, and that's fine too. So who are ideal candidates for microcoring? So the FDA approved this device for Fitzpatrick skin types 1 through 4 because any 5 and 6 skin types can cause hyperpigmentation, or I would assume that it would be a risk of hyperpigmentation in those patient skin types. So Fitzpatrick skin types 1 through 4, and also usually the targeted age is 40s, 50s, and 60s, or anyone that is starting to have like a little of those smile lines or perioral rhytids, or a little bit of laxity right here, or the nasolabial folds, marionettes, and kind of like the lower to mid face laxity. Those are the ideal candidates for this treatment. Usually anywhere from 1 to 3 treatments are recommended, spaced about 1 to 2 months apart. And also younger patients who have textural irregularities, larger pores, acne, scarring. Now laser resurfacing is also a great option for you too, but I feel like microcoring would be a different mechanism of action that may even show more promise or be a good adjuvant therapy to what is our number one top treatment for acne scarring and textural irregularities, dermal pits, and things like that. Up to date is laser resurfacing. So I think microcoring may be a good adjuvant to that treatment, or maybe even better. I think only time will tell, and I'm very excited about seeing where this takes us. Another candidate who would benefit from microcoring especially are people who need a lip lift. So lip lift is when you remove excess tissue to kind of avert, oh my god, it looks so crazy. What if I walked around looking like this? So sometimes, and I refer my patients to plastic surgeons sometimes to do a lip lift surgery, because sometimes if you have a thinner upper lip, and the length between our nose and our upper lip lengthens as we get older. It's a sad truth. It happens to us all. But when you do a little excision, which is called the lip lift, where the plastic surgeon takes that tiny bit of skin from underneath the nose and kind of pulls it up to avert the lips. Or, we can do that to a certain extent with Botox, which is we call the lip flip, or a little bit of filler to kind of avert the lips. Why does that do it so much when I do that? Sorry, guys. Okay, well, what Ellacor does is, because you're removing skin, it's basically giving a lip aversion or a lip flip or a lip lift without that scar that goes right underneath the nose. Because when you excise that tissue out, and when you remove it in little bits and pieces, in little fractionated columns of skin removal, you're shrinking that space between the nose and the upper lip, which is going to give a more youthful look. A shorter distance between the upper lip and the nose gives a more youthful look and just averts the lips to show more red part of the lip, which gives a very youthful, beautiful appearance, especially when you smile, and especially for those of us who feel like your upper lip is a little bit thinner, it'll help avert it out, because you can only do so much with filler. I love doing lip filler and lip augmentation, but I'm a very conservative injector. If you follow me, you know that. If you follow me on Instagram, you see my before and afters. I do lips all day, every day. But my thing is, I do it very conservative. Usually, my patients' husbands, spouses, boyfriends don't know that they have any lip filler, but it does give a very natural lip aversion, but only to a certain extent. But for people who need a little bit more, or they need a more substantial decrease in that distance or more lip aversion, you can only do so much with lip filler. And there's tricks that I've learned along the way, but I never want to do too much. And so if somebody's not getting the results that we're looking for after one syringe or maybe, 2 syringes over a certain amount of time, then I refer to plastic surgery to do a lip lift surgery. And I feel like Ellacor and microcoring is going to be a good answer to that without surgery, just kind of just averting the lips and giving a very natural, if you will, lip aversion or lip flip. And I've done whole lip augmentation YouTube videos, so watch those if you haven't already, because I have a lot of pearls in those too, and I think I have before and afters. So the physicians who have been using this, all mostly from Harvard and very well-respected experts in the field of dermatology, were saying that their patients say that their skin looks better, it feels better, the texture is better, the skin is tighter. And it also was giving results that you would usually have to use filler for. So, usually the nasolabial folds and the marionette lines, usually we inject filler into those areas, or plastic surgeons sometimes do fat transfer to increase volume to stretch out the skin. Those are the patients who do the best, and Ellacor with the skin tightening makes patients look like they've had filler, but without that over-injected, over-full, weird, distorted look that a lot of people are walking around with these days. I'm in Orange County and I see it all the time, and it scares me and it scares my patients, and I'm happy that they come in to see me, but I understand it and I get it when they say, I don't want to be walking around with like those girlfriends that I saw last night who have like these overfull faces. So I think it's a great and it's a perfect timing. It's a great option for a non-filler improvement of nasolabial folds, jowling, and just kind of like that lower face skin laxity. So just to recap, patient satisfaction has been through the roof. Everybody loves this. I think all patients who have had this procedure have been very happy. Back in 2017, all the patients, I don't know how many cases I did, but definitely, close to 100 cases. Everybody was happy. Everybody had amazing results. And now I'm sure that once this is launched and more time and more people are treated, things may come up along the way. But for right now, patient satisfaction rates are very high. The tolerance is very acceptable. It's actually not painful as of a procedure. My colleagues who've been using this device, and when we perform the procedures in clinical trials, we would use topical numbing, and I would do local anesthetic as well, and sometimes we would do nerve blocks, but that's all that was needed, and the patients would be fine afterwards, and would heal and recover without any post-procedural pain. It may be painful to look in the mirror because you look a little beat up, but it's actually not even that bad, but you feel okay, and the recovery time is very rapid. And then experts who have used this device are very happy with it, which means a lot to me. I can read and look at all the before and afters that I can get my hands on, but hearing from people who I know and trust and who are leaders in the field of cosmetic dermatology, it really means a lot to me that they're recommending this procedure as well. And just a little side note, when I was a fellow in clinical trials using this device for the first time, I'll never forget this. I was at the Laser and Skin Surgery Institute of Northern California, and Dr. Suzanne Kilmer's 2-story 20-something room laser center, and it was me and this girl. Her name was Frankie, if you're watching this, I highly doubt you will be, but she was from MIT, and she was the coolest girl. I think she just went straight through, she didn't go to college at high school. She went straight through, to MIT, to college, and was just this brainiac who was on a DOS computer saying, how does that weight feel? How is the torque of the, the handpiece? What can we do to make it better? Is it too loud? How does it feel in your hands? Does it hurt in your shoulder? And it was just so cool because I could be like, oh yeah, it's a little heavy. I can't really visualize the field that I'm treating in. Can you make the sides of this device clear? Different things like that. And she would go into her DOS computer and like totally type out. It was just the coolest experience to be able to participate in clinical trials and see something in that infancy of it and just see what it has become today. So I'm really excited about it. And again, not sponsored, totally authentic, and I probably will get this device, and I will probably speak on it if it ends up performing the way that we hope it is, but if not, that's okay too, and I don't do any paid sponsorships, so anything that I say is truly from the heart, and what I recommend is best for you guys. So thank you for listening to me, and hopefully this sheds some insight on microcoring and Ellacor, and hopefully down the line when I have a little bit more experience with this newer platform and the final the final device in its entirety. Hopefully I'll have some more feedback, and I'll do another YouTube video later on with some of my own before and afters and patient testimonials too, if it ends up being everything that we hope it is. So thank you for following, and drop a comment in the comment section if there's any questions that you guys have or any videos that you want me to do upcoming in the future. I see you, I hear you, and I give preferential treatment to my subscribers, so please subscribe, hit the notification bell so you don't miss new information that drops every Sunday morning. I love you guys.